My name is Jessica Nauris, and welcome to my page, Adventures in Autism, the Paraprofessional's Guide in Understanding the Characteristics and Best Practices when Working with Students on the Autism Spectrum. Let's get started. If you click on the Start Here button, it'll take you here. You can see my welcome letter to the paraprofessionals who are with us and why this project is important to me, as well as why it's important for you as paraprofessionals to understand the characteristics and need, as well as some strategies that you might use when working with students who are on the autism spectrum. On this site, you will find the definition, causes, and diagnosis of autism spectrum disorder. You will find the characteristics that are typical in someone with ASD, what that might look like depending on their age, some strategies to help students navigate as independently as possible, and some research-based resources. It's often difficult to define what exactly autism is, but according to the DSM-5, there's two main areas: that social communication and interactions, and restricted repetitive patterns of behavior, interests, or activities. You can read some more information about that. And then there is a video over here for you to see what that might look like in a young child who's exhibiting autism behaviors. I also have a case study example of a situation that you might see in a classroom. Down here is the steps for what is needed in order to get an autism diagnosis, as well as the screening tools that might be used or diagnostic tools that might be used in receiving that autism diagnosis. The characteristics of someone with autism is that they have difficulty facilitating appropriate social communication and behavioral skills. So I broke that down in this section right here. So there's 4 areas under language. They might have some language deficits. They might use language in odd ways. They might only understand the literal interpretation or meaning of language, and they might have difficulties in pragmatics. And then I gave some examples for what that might look like. So the social differences, they might not have difficulty understanding the theory of mind or empathizing with somebody else, or understanding that people don't have the same thoughts or feelings that they do. They might have deficits in facilitating appropriate play skills and behaviors. They might have difficulty understanding emotional expressions or responses. They have difficulty with imitation skills, and they have difficulties facilitating joint attention. And then some examples of what that might look like as well. And behavior, which also falls under social, is that they might insist on sameness. They might have stereotypical mannerisms such as hand flapping or finger flicking. They might display self-injurious behaviors. They might struggle having an imagination. They might appear rigid, and they might have some savant skills as well. And then there's some examples of what that might look like. Down here, you will find the areas of strength and areas of need in students who are on the autism spectrum. Strength is that they typically have excellent memory skills. They're often skilled in a particular area. They're usually pretty honest and direct in their communication. They thrive with routine, and they are visual learners. And then the areas of need, again, are broken down in those 3 main areas of language, social, and repetitive behaviors or restricted interests. Some strategies that you might see used in a classroom working with students who have autism are definitely some evidence-based practices. And a lot of these are already implemented in the classroom, oftentimes without the teacher even realizing that they are evidence-based. So looking at instructional strategies, discrete trial teaching is a big one. Prompting, using a time delay, using the naturalistic intervention or pivotal response training, those are all instructional interventions that can be used. Social and behavioral strategies. Some people might use antecedent-based interventions, which basically means what can you do to be proactive to prevent the behavior, such as using visual supports, offering reinforcement, and then how to extinguish the behavior as needed. And then there's some social skill strategies in here as well, such as using video modeling or a task analysis to teach those areas. Scrolling down, communication is a big one. People with autism definitely have deficits in in the area of communication. They might have issues engaging in joint attention. They might have difficulty using gestures or following gestures, but they can be taught to use symbols and gestures to create a communicative intent to improve their joint attention skills. Language might appear limited or echolalic. They might repeat things over and over again. And then over here, there is some functional communication tools that can be used to teach students on the spectrum how to communicate functionally. The picture exchange communication system is big when working with students on the spectrum, as they naturally perceive visual information with a higher understanding than they do auditory information. So even for those students who are verbal, having the picture card there to give the expectation often helps them as well. There's 6 phases in PECS, and they're listed here. Some students might use speech generating devices or technology to aid in their communication, and some students might use some signs to communicate. There's more information in this area for you to read. And then down here as a parapro, it's imperative for you to help facilitate a positive learning environment. There's lots of ways to set up the classroom for success by creating clear boundaries, which also help the students stay organized and feel secure in their classroom. And the visuals help, again, with that visual information, it helps them to stay organized as well. Here's some additional resources to help facilitate working with students who have autism spectrum disorder. I believe there are 8, no, there's 10. So here's some websites for you to look around to get some additional information, and the references page for where I got my information from. Thank you guys so much for giving me the time to go over my site with you. I hope that this is a huge help, and I look forward to hearing from you. Thank you.